Welcome, everyone, to Living Life Naturally podcast. Welcome to you, Kathleen.
Hey, good morning.
And it's afternoon here in Florida. You're obviously Pacific time
Yes, I am. Yes, I am. Right now, right now.
right now.
hmm
So, where are you joining us from?
our headquarters are in San Francisco, although I work for Midi, which is across the nation. So I'm frequently
Mm,
in Florida
mm,
and the East Coast as well.
mm. So, let me tell you a little bit about Kathleen. Today, she is the Chief Medical Officer at Midi Health, the nation's largest menopause care platform. And at Midi, she leads a team of hundreds of clinicians serving women in all 50 states on their virtual telehealth platform that serves women in midlife. She is a menopause certified provider and trained internist. Her background, always a proponent of digital health and solving access issues. She's worked to leverage innovative technology into patient care. So, after running her practice, she became a chief medical officer at St. Francis Hospital and most recently a leader in women's healthcare startups, first Tia, and now she serves women in midlife at Midi Health. So her career has been highlighted by establishing this telehealth service at the hospital site, attaining health equality leadership certification for the hospital and its programs, and establishing a new trans health program in San Francisco for which she is awarded the Leader in Innovation Award. She joined the founding team at Midi Health to help all women live better and longer, and her expertise has been seen in the Washington Post, CNN International, Yahoo News, People Magazine, and many others. She's a graduate of UCLA School of Medicine and Stanford University, and Midi Health has experienced fantastic growth and recognition since its inception in 2021, and this year has been recognized and named by Forbes and LinkedIn as leading startup watch. That's absolutely phenomenal. So glad to have you here, Kathleen, and be able to chat with you about the things that are most on my listeners' minds, that whole menopause thing. And it is a thing at the moment because it's still so unknown in many areas. And you've focused on hormonal and non-hormonal prescriptions. So
Mhm.
tell us a little bit about, did you have your own journey during this time of life that propelled you into working a lot with menopausal women?
It's a good question because it's probably no coincidence that the founding team at Midi were all women that had been just going through perimenopause or menopause. But I think really this has been the culmination of a lot of life experiences you mentioned. I really saw how telehealth can be answer a care gap. I mean, you can really get there quickly. You can get expert care all over the place, really. So I really believed in telehealth as a care gap solution. But then I went through perimenopause and menopause and was actually trying to get care in a major city with major medical centers and realized how massive the care gap was. And then, of course, I'm in the Bay Area where all health tech startups seem to start, and I was approached to actually try and help answer this care gap with Midi Health, and I joined the founding team, and it's been a wild ride.
I
I
bet.
will say, yeah, we knew there was a care gap, but what we see is just sort of insatiable demand across the nation. As soon as we open up in a state, visits are booked. We grow, we hire clinicians, so we quickly get more appointments available. But it's really been a joy to be part of actually answering and being part of this care solution,
Mm.
really.
So, Kathleen, have you found that by opening MIDI in so many different states, you've been able to establish more physicians or clinicians who can help women in the menopausal stage of life?
Well, you hit one of the sort of one of the care gap contributors is that there weren't enough trained providers in the US. So what we've done at Midi is we created a training program. So we actually hire very experienced, wonderful clinicians that bring in years of expertise on women's health in general, and then really kind of get them up to speed on all the different nuances of menopause, all the most up-to-date formulations, most up-to-date literature. And then we support them with experts. And this is really the fun part. So we have national experts that are on the cutting edge of this. They can sit in one location and through telehealth and other tech-enabled ways, they actually help the providers across the state. So I know when I was in private practice, I would have loved to, like, sometimes I just have a question I want to ask an expert. I, as an expert, could step out of the room, go talk to an expert, and bring it back. And in that way, I get better as a provider all the time. So we really have this incredibly expert workforce now in all 50 states, and they're supported by national experts. So they can pop in and get advice and direction from a skin and hair specialist, a sleep specialist, an internist, an OB-GYN. And I think that really keeps us from sending women around. I feel like the journey for women in menopause is that they go to their OB-GYN for the period changes. They go to the primary care for the metabolic changes. They go to their naturopath for their fatigue. They go to their personal trainer. They go to the dermatologist for the hair thinning and they go or for skin changes. And it's just sort of an endless circle that
Yes.
takes a lot of time. It takes a lot of time. So it's so what we do is sort of give care holistically through one provider, but that provider is supported by all these experts. And then we do a ton of training. We have weekly training sessions that all our providers attend just to get the most up-to-date information always.
Mm. Yeah, and that's very true because I found that even here in Florida, you have to go to your healthcare provider, as you say, for metabolic problems. And
Mhm.
then you've got the gynecologist who doesn't necessarily have the expertise in women's menopause and what they're going through and how they can naturally get through it. And then the dermatologist with the thinning hair. And yes, it is. It's like exhausting thinking you're going to all of these places um, and paying out a lot of money, really, if you add it all up, just to go to these different people and to have it integrated in one place where a provider can go and get the expertise necessary from somebody else is really a time saver for the patient.
Well, and it's the difference between someone getting care and not getting care. I mean, women are busy. It takes half a day. You have to take half a day out of your life to go to the doctor between commuting, parking, waiting room. Generally, people block off 3 to 4 hours. And so, women are busy. They're taking care of aging parents. They're still taking care of kids. They're have increasing job responsibilities. There's financial stressors that come in midlife too,
Mm.
right? There's planning for the future. Sometimes it's paying for college, you know. So there's a lot of stress. There's illness, there's partners with illness. So I have women do visits from all over the nation. They do it from their car. They do
Mm.
it from, I have one woman who she did her visit from the ICU room of her mother because she wanted to stay by her bedside all day. These are women that would not otherwise be getting care because they're not putting themselves first. And I'm really happy to actually deliver just a convenient, easy access solution for them.
So a woman, say, is in menopause or perimenopause, and they need help. How would they even find how how would they know how to find your company to get the help that they need?
Well, we try to make it easy. So it's MIDI for midlife health. So go to joinmidi.com and you'll see the information. There's a button. You can book an appointment. You can put it, if you put in your insurance, we will tell you if we're covered under your insurance. We're covered under most PPO insurances. I think that's another big key to just being accessible because this type of care has historically taken place in concierge practices because it takes a lot of time. You have to spend a lot of time with a woman to actually find out all the symptoms, what she's tried, what hasn't worked. You really have to, it's really hard to do that when you're scheduling people every 5 to 10 minutes. So at Midi, you're scheduled for much longer appointments. And we also ask you to fill out some information before you come so that that doesn't take up the time of the visit. We can really spend a robust amount of time walking through your symptoms and your care solution.
And that's the other thing with going to a regular medical provider's office. They usually slotted 15 minutes of time. My doctor is really great and he spends whatever time is needed with me, but I
Mhm.
recognize it's very unusual. Um, I don't think he puts in extra time for me, so I feel bad for whoever comes behind me because then that always puts him behind. But he never kind of hurries me through. And so you're doing the same kind of thing with your people that come to you. You're giving them time so that you can get to know them, you can get to know things from their past that might have an effect on where they're at today. You get to talk to them about what their symptoms are. And I think that it's really great because it's very hard to find holistic solutions or somebody
Mhm.
that will give you the offering of holistic solutions for what you're going through.
Yeah. Well, one of the things I like about using telehealth is that I will send our patients a survey before they come that just asks them, do you have this problem of menopause? Do you have sleep trouble? Do you have hair and skin changes? Do you have vaginal dryness? Do you have metabolic or weight issues, adjustments since menopause? Obviously, do you have hot flashes and night sweats? And then if they say yes, I ask them a bunch of more. What have you tried? What has worked? If it's sleep issues, is it trouble falling asleep? Is it getting up in the middle of the night? Do your mind race? So before the patient even comes in to see me, I get a pretty holistic view. But the process is it benefits the visit because we can then spend much more time talking about and exploring care solutions and answering a lot of questions, which I find that in most doctors' offices, there's not a lot of time to answer questions. But also, I find it educational and empowering. So, because I ask every single woman if they have trouble sleeping and hair and skin changes or vaginal dryness, these are things that they might not bring up with their doctor,
Mm,
but they're happening, and it kind of normalizes it and gets the conversation going because there's simple and easy solutions for that. So please do bring them up to your doctor if you have those symptoms or
mm.
clinician, not just doctors. Lots of
And so you listen to a patient and then do you offer certain supplements for them? Do you offer just the holistic lifestyle type remedies for them?
So we're fully licensed to prescribe. So we prescribe hormone replacement therapy or hormone therapy for women who want it and need it. We do non-hormone prescriptions as well. I would say, for patients who maybe don't want to or can't take estrogen, maybe they've had a estrogen receptor positive breast cancer or something. So that's where you'll see us leaning into some non-hormone prescriptions. Then we also do lifestyle and integrative solutions as well. Like, for example, exercise, like just telling women, so exercise raises your serotonin levels and actually helps you sleep. And menopause actually depletes your serotonin activity levels, right? So we know it's a contributor to the massive sleep disruption that goes on. So there are some lifestyle and sort of sleep hygiene things that are evidence-based that we share with patients as well.
And what kind of things do you share about sleep? Because I get so many people that come with sleep issues, so common in menopause.
Oh, it's so common. And it's too bad because there's employer surveys that show that women are leaving the workforce because they're exhausted. They just are too
Mm,
exhausted. So they're quitting their jobs and sort of leaving in the peak of their career. I think it is a little bit part of the glass ceiling. So, but two-thirds of women in midlife, in perimenopause and menopause, are not sleeping well. Like to the point it's interrupting certainly their daily quality of life and sometimes their daily activity. So it's hugely common. You are not alone. I do start with hormone therapy because if this has been a new sleep disruption that started in perimenopause or menopause, we do know that those hormone changes trigger a lot of sleep
Right.
disruption. I mean, we know that it changes activity of multiple neurotransmitters, GABA, serotonin, dopamine. Um, so what we see is actually when we put people on hormone replacement therapy, it does help. Certain formulations help more than others. Certain doses help more than others. For some, it's progesterone, but you generally want to use the micronized progesterone that actually helps. So there's so but basically I would start with hormone replacement therapy. But that's not the only thing. For a lot of women, it's stress. Stress is happening in midlife. So sometimes it's stress management. Sometimes it's a supplement that can help with stress management. Sometimes it's a lifestyle intervention, like getting to use a CBT app. They can use exercises, both the stress management and as a serotonin boost to help you get to sleep. Um, there's lots of things. Not drinking. We have to also remember
Mm.
what we do right before bed is going to influence our sleep.
Right.
So
Mm.
I will say in midlife, and I hear it over and over, that we don't sort of tolerate alcohol the way we might have when we were younger. And our sleep is more fragile, so sleeping close to bedtime is really disruptive. And then we have hot flashes and night sweats. So hot flashes and night sweats disrupt your sleep. They don't hurt you, and so people, there's late night TV jokes on them and things like that, but they're actually affiliated with higher rates of heart attack and strokes. There's an inflammatory component to them,
Mm.
and they do keep you from getting into a deep sleep. So managing the hot flashes and night sweats will help quite significantly. And that's actually why brings me full circle why I start with hormones, because just managing those is helpful. But there's other environmental things you can do, cooling your room, there's cooling blankets, there's all sorts of things you can do to moderate your temperature control that will help you sleep as well.
And how many women do you encounter who have hot flashes during the day and have to have help because they're so bad at work?
What's interesting, the national stat is it's really about three-quarters of women are going to have hot flashes and night sweats that are appreciable. They range in severity. For some women, it's a quick 30-second flush. Other people may have 5 minutes of like drenching sweats. So it can vary in severity. But there is about a quarter of women that don't really get any appreciable hot flashes and night sweats. They may have other symptoms though. They may still have sleep disruption. They're likely to still have the metabolic changes, right? Changes in your lipid profile and your glucose metabolism. Um, so it does vary. And the journey through perimenopause and menopause is very unique. I mean, we see tens of thousands of women a month, and every story is unique, and the constellation of symptoms and the severity is unique, and they end up with a unique care plan actually at the end.
So when you put them on hormone replacement therapy, is it like a bioidentical type of hormone therapy, or is it a traditional hormone replacement therapy?
So our most frequently prescribed is a bioidentical combination of estrogen and progesterone. Now, that doesn't mean they're compounded though, and I want to make sure the listeners know the difference, right? So compounded means that they're made in a local pharmacy, sort of in batch, not made in mass quantities, not made by pharma. You can get very unique recipes. You also sometimes don't get the shelf life and their stability, and you can get some variability in compounding. They can also be expensive and they're often not covered by insurance when they're compounded. There's definitely care solutions in compounded medications. We use them frequently. For example, the bioidentical progesterone that we would prescribe that is FDA approved, that's covered by your insurance that you can get from Walgreens has peanut oil in it. So if someone's allergic to peanuts, I would prescribe the compounded to get the peanut oil out of it. So we use both. We use bioidentical. We also use compounded, and then there's obviously times when we use other synthetic progesterones as well. So if you're looking for birth control, for example, birth control pills can have some synthetic progesterones in it, but they do offer you the benefit of controlling your fertility. Right? So
Mm.
in perimenopause, you're still ovulating, so that still it still needs to be managed.
Yeah, that's interesting to me that, I mean, really, that we see more and more women having children later in life. Um, for me, I had a partial hysterectomy, so I still had my ovaries. So
Mhm.
I kind of figured that I went through two menopause things because I had the hysterectomy, which threw me into menopause, but I was still ovulating.
Hmm.
Still had then when my ovaries stopped functioning so well, then it was like going through it all over again.
And did you know you were going into it because of the hot flashes and night sweats?
I
Or?
never actually had many hot flashes, very
Mhm.
few hot flashes. No, it was probably the other symptoms that you hear about, not being able to sleep, mood
Mood
swings.
changes. Hmm.
Since I've been working in this area, I've become much more aware of the different symptoms that perimenopausal women had. Like before I started studying it, I didn't realize anxiety and depression could be part of it. Um,
Yeah. Or
yeah.
it can exacerbate anxiety, depression.
Mhm.
It can exacerbate or even cause new diagnosis of ADHD. Because we have estrogen receptors everywhere. So there's estrogen receptors affect, neurotransmitters. It affects our metabolism. We have receptors in our liver. We have receptors in our joints and our skin. So it really does, you feel the estrogen depletion for sure.
Yeah, you do. And then, of course, for me, there was the whole hair thinning part, which partly is genetic, I know, but yeah, I used to laugh at some of the girls when I was working in the corporate world when they were talking about, oh my, everywhere I look, my hair's on the floor. And I kind of found it amusing till it started happening to me, and it wasn't so amusing.
No, it's part of your confidence, so your appearance is part of
Yeah,
confidence for
yeah.
sure. Well, I'm excited on the hair front. Do you know there's sort of a new formulation that can actually help with hair thinning. Have you heard of Latisse at all? Do you
I
know?
have, yes.
Latisse has been around, I think now,
Yeah, a long time
well
now.
over a decade. It's for eyelash lengthening.
Right.
But there is a compound in that same family of drugs called botanoprost. And when you combine it, we've used minoxidil. Minoxidil helps a
Yeah,
bit.
yeah.
It helps a bit, but adding latanoprost to the minoxidil when you do a topical solution is really helpful and actually can help your hair grow. So
Mm,
we do have a compounded formulation of that actually because it's not on the market.
mm. Yeah, and I found because I was very sick in July and had pneumonia and sepsis, and so of course it took my body like 4 months to recover from that. So then all the hair that had grown back in all fell out again. So, I think that for our ladies, they need to realize it's not just about um, some of the things that you can get to help balance your hormones. It's also the things that you mentioned the lifestyle changes that we have with the exercise, with the eating healthily, as clean a diet as we can have, um, getting
Yeah,
enough sleep. And if you're not getting enough sleep, then learn some good sleep hygiene tips that can help it be a bit better for you. I mean, there's so many moving parts in even when we're younger, but we seem to have the time to focus on them when we get into midlife.
I'm glad you brought that up though. There's lots you can do. So I think I spend a lot of time sort of addressing symptoms and sort of the problems people have in midlife, but midlife can be fabulous. I have many women
Yes.
who this is their favorite time
Yeah.
of life. You can feel great. So if you don't feel great, just know you can feel great. And you should feel great and you deserve to feel great. So I just encourage people to talk about the symptoms they have because there are lots of evidence-based ways that you can small changes can make a huge difference.
Yeah, absolutely. Absolutely. And that, I mean, I proved that to myself throughout this whole recuperation process because I wasn't able to exercise. I wasn't eating the way I normally would eat. And, it made a huge difference to me. My energy level was so low, but I couldn't be bothered to get up and make myself anything that was healthy, if that makes sense. So, we have to recognize what we're going through and never be afraid to ask for help because we all need it at times. And, never feel like you can't find a better practitioner maybe than you're going to now. Do
Mhm.
some more research. People are so stuck on everything being traditional that it's more than that.
There is, well, I think there's an exploding amount of information coming out. I
Yes.
just read somewhere that the information in medicine doubles every 72 days. So it's
Mm,
very hard to stay up on it. So, you know, getting going to a provider who's staying up and aware on things is going to be critical for you to benefit from all the recent evidence as well.
right.
Well, I'm
Right.
glad you're feeling better. That was a lot.
It was a
We
lot.
sense our mortality, huh? A little bit.
I tell you what, it gave me a new perspective on life because I really did. They almost lost me twice
Oh, I'm
because
sorry.
my blood pressure dipped.
Bottomed
So
out.
um, my doctor said to me, it's a good job that you were healthy to begin with, otherwise you probably wouldn't be here now. I'm like, thanks, I really needed to hear that.
Well,
But it's
and
true.
reinforces your
Yeah,
life's work and wellness
yeah,
as
it
well.
does.
Yeah,
Yeah,
yeah, it does. No, I think that is definitely true. I think the biggest predictor of how somebody leaves a hospital is how healthy they are going in. There's some irony in that, but
yeah,
it
yeah,
makes sense, and it speaks to all the work you've done, right? And we need to lean into wellness. I mean,
right.
one of the big benefits of hormone replacement therapy is bone health, so you don't get fractures because when you're talking about fractures, then you stop moving and then you become bedbound and then it's linked to actually further debility down the road. So actually just simply taking HRT for bone health in your 50s can help prevent problems in your 60s and 70s. But there's lots of other things you can do. Diet and exercise. I mean, exercise helps with bone health as well. Weight
Yes,
bearing
yes,
exercise.
yeah,
Um, Eating the right diet certainly helps with bone health. So what we do in our 50s is going to set us up in our 60s, and what we do then sets us up for our 70s. So I love the work that you do with getting the word out
thanks.
on this podcast and books you've written, and just having people lean into wellness is
Yeah.
fabulous.
I think that because I've always found exercising to be not my favorite thing to do, but my number one goal is to stay healthy and have that longevity with good health. And so I think that if you think about it from that perspective, it's easier to get out and walk or exercise, do whatever you want to do, because our health is really everything to us. If you don't have health, if you don't have good health, just go and ask somebody that doesn't have good health, what's their quality of life? So we want to do everything in our 50s and 60s so that we can live into our 70s, 80s, and 90s and not be constricted, not be on a walker. We want to be, and I realize that's it's not for everybody that they can accomplish that, maybe because of genetics or some accident that they may go through. Um, but, I know people who exercise because they're going through menopause, but also they've had high blood sugar. They've been diagnosed with diabetes, and they also keep their health on top of the mind. And they've had extraordinary changes in the way that their diabetes and their sugar levels have become when they live that healthier, more holistic lifestyle.
Oh, for sure. Yeah, I actually have prediabetes because I have a family predisposition to it. And so I track that literature. We have a nice program at Midi. 40% of women in menopause and perimenopause have prediabetes, and
Mm,
most of them don't even know it. So they're not even getting screened. But definitely when our hormones deplete, in perimenopause and menopause, it affects our insulin sensitivity. So you'll see lipid panels go up. And I have people that say all the time, just what you said, that I haven't changed a thing, but all of a sudden my cholesterol is high and my sugar is high and I'm gaining weight. And so that is a very normal response. So I think part of the work you do in getting the word out is that, yeah, midlife things change. We can adjust with it in order to continue to optimize our own health, right? So
Right.
prediabetes, there's lots of stuff you can do. Adjust your diet. Exercise actually helps
Yeah.
insulin
Yeah.
sensitivity. Um, some diet approaches actually help. Some medications do help as well, but you know, I do not believe that every answer is in a prescription pill, but some are.
Mm.
Some are.
Yeah. So, where is the best place for people to connect with you?
So joinmidi.com. Make an appointment. Make an appointment. There'll just be a place on the website that says right there. Make an appointment. We work very hard to make sure the appointment's available in every state, usually within a week or two. Once we hit a 2 week wait, we sort of bring in recruits. So so generally you can get in, make an appointment, do the survey before you get to the appointment because it helps the appointment really go much more get deeper and more substantive because you'll have put in all sort of the logistic stuff beforehand and go from there. Then you stick with that provider, they work with you until you're feeling great. And then you
Great.
can, yeah, you can communicate with us on the portal any time, day or night, async and send messages and we work just like a clinical office would, except we're on your computer in your home.
Yeah, that's great. Thank you so much for being with me today. I appreciate it, Kathleen.
Oh, thank you, and have a good afternoon.
Thanks.
All right, take care.
Bye. You have been listening to the Living Life Naturally podcast, where we're on a mission to inform, inspire, and encourage women to live their best life confidently, joyfully, and freely from what's been holding them back. For show notes and free resources, visit holistic-healthandwellness.com. And I'd be delighted if you'd follow us on socials to connect further. If you enjoyed this show, why not share it with your friends? If you found good value, chances are they will too. And of course, a 5-star review on iTunes is always greatly appreciated, as much as I appreciate you listening. So until next time, live life naturally and joyfully.